Good morning. This is day 2. I am getting up. I already fed the dogs. So I'm trying to video myself for 30 days straight. Maybe 90. We'll see. In one of the busier months that I can anticipate coming up. I did a gloss on my hair last night. I'll share a video on that brand. I mean, I don't know that I see a difference, but I let it air dry, so we'll see what it looks like once it's done. It's a little glossy. Oh my god, hold on, let me. Y'all don't want to see that. Taking my Invisalign trays out. So, here I have work, full day of work, and this is a must. If you have any type of dental tray, you need to have one of these ultrasonic cleaners. There's no way around it. So, I'm gonna brush my teeth really well. Be right back. Okay, back, teeth clean. So my night routine includes tretinoin, and that's the 0.1. And I sandwich it, so I put the lotion on first, and then I put this on. I put on my face, my neck, my chest, and the back of my hands. And then I put lotion back on top of it, and I use the CeraVe. I also got the Vivace treatment. It's spelled like Vivace, V-I-V-A-C-E. So it's a radio frequency microneedling, but it's not as deep as like a Morpheus for your face. And I really like the results. I asked her to go like really low the first time because I was scared to death that I was gonna kill the fat in my face, because that's what radio frequency can do. But I say all that to say that I don't use a harsh cleaner every day. Usually just like something gentle and a warm washcloth, because I'm not trying to rip my skin off. Oh, it feels so nice. This is an ugly washcloth. All right, so on to the fun stuff. I guess I need to like straighten my hair or something, because this is looking crazy. See, this is why I don't do these recordings, and I'm holding myself accountable, because I'm a discombobulated person, if that is even the way you can say something. Hold on, let's see if this light helps. Ooh, a little lower, because I get migraines and we don't need to start one of those. Okay, let's plug in. Yeah, I have all the blow dryers and all that kind of stuff, but I just really want a simple straightening for today. Put this down. Take to the counter. Okay. I swear I'm gonna look back at this and be like, what were you doing the whole time on camera? Anyway, here's Phoenicia. Azelaic acid. I'm just gonna make this a series on how do you say that, because what the hell. All right, so this thing is like actually really thick. The gel, I wonder if I would even like that more, but this works really good. And my pimples, when I put it on there, it's like gone within 2 days, 1 to 2 days, but it takes forever to dry. So we're gonna move on to the hair. Ooh, exciting. I did this gloss, but I would imagine it's not heat protected. So to the jar of things that I own. Where is my spray? Blow dry mist. I don't use it for that. So we'll take half this hair. Whatever this is. Oh great, I don't have a clip. We'll do a scrunchie. Make it magical. This shirt is by Ivan Orama, by the way. I've had it for years. It's now turned into a home sleep shirt, but I love it. He's a great artist. So my understanding of heat products or heat protectant is that the idea is that it just is supposed to evenly disperse the heat on your hair. Maybe I need to read more about that. But so I like to brush it in before I start doing anything. Probably help if I turn this on. We'll see how mornings go. But I'm gonna stick to this. So today is just a full day of work as a nurse. Exciting stuff. What I really need to be doing is tonight when I get home, focusing on getting all my textbooks because I've had so much going on personally, like real big stuff. So I have not been able to purchase those yet or really sit down and be my best self for the upcoming semester. So besides setting all those dates apart, because we know I need those days requested off. But now I get to really sit down into the syllabus. And we were actually given by one of my classes a head start. So here we go. Ma'am, come on. Let's get out. Get out. Thank you. I'm not dealing with that. All right. My dog likes to bark at anything that is moving and flying over her head. So she's a Frenchie and I don't want to be jumping and like overextending her neck or anything. So my poor baby has to be put out, but it's for my sanity and her bones. So back to where I was. So my classes, she actually gave us a head start of what material we should be focused on for the first test. So I'm gonna sit down and look into all of that. That's exciting, I guess. And at least I can get a head start and not feel so crammed, which I can absolutely appreciate. I am taking 13 credits this semester, which I just really haven't said out loud because it makes my stomach hurt, but it's gonna be good. And I really like this. I'm in a nurse practitioner program. Sorry, let me leave with that. I gotta get better at this whole, like, this is what I do and this is why I'm here and blah, blah, blah. Like, I'm just, these social media people are great. They really are. They've like got it down pat. They're selling you the programs on like how to do it, and I'm not paying for it. I'm just gonna like wing it and learn. Here we go. Make mistakes along the way. All right. Anyway, 13 credits this semester, nurse practitioner program. I'm in an adult geri primary care program. What that means is I can see people 14 and up when I graduate and get a job. But we're gonna focus on just this semester, because when we look too far ahead, we can get overwhelmed. And when I say we, I mean me. And so I work at a teaching hospital and I get to meet a lot of different fellows and residents, and I always ask them their tips or whatnot. Not saying we're in the same thing, they're clearly on a different track, but they do give good advice about how hard the workload is. So focusing on the small things, focusing on the small steps ahead of us, that's all we can do, small victories. And then we can look back at the end of the semester and say, yeah, all done, next one. Because it can get to be a lot. Like, this one class has, I think, five major tests. And one's cumulative, which means all of the material will be on it, which wouldn't expect any less. And then the program I'm in, they're super good about like making sure that we have good experiences. So like my health assessment we just got done with, and we got to practice on live models, which I think should be something that's part of every program for nurse practitioners. That was a very cool experience. We had 2 different days with live models. I do wish we could have more, but I also know like scheduling and cost and all of that I'm sure is factored in. It's already hard enough trying to work and go to school and live in America. So 2025 showed us that groceries are going to be quite an asset going forward as far as how much they cost. So that's where we're at. I'm wondering, I'm gonna think about the things that I want to talk about on here, because clearly you have to have like a purpose, right? So we're gonna find that purpose within the next 3 days. So I'm sorry if you like to hear me babble, you can stay. Otherwise, I'm gonna find, I do think this kind of gave me a gloss. I don't know if my hair kind of looks a little drier, to be honest, but I'm gonna, I mean, the thing does have glycolic in it, so I don't know. I mean, it is what it is, and we're gonna work with this hair. I'm not I don't know. I think I like the Kristen S gloss with the copper. I think it gives like that cute little hue, gives you like the ginger kick. But this is my natural hair color. I'm auburn. It was brighter when I was younger. Now it has turned to this reddish brown, which I still love. So that's why I let my little white hairs do their thing, because I don't want to change the entire color of my head. All right, next thing. Hair's done. Okay, back. I was kind of rambling back there. I go with my vitamin C. Ice Clinical sample, because I ran out of my normal stuff. And get it to the neck if you can. But see, I'm very proud of my skin. It's come a long way. So there's that. I don't think I'm gonna use what I used yesterday. I'm just gonna do the peptide. That's the Naturium. I don't know. I didn't realize how many sound effects I did until I started recording, which I don't know if that is annoying or not. But again, here we are, raw. Hello, eyebrows. Do your thing. I do not want to put makeup on today, so I'm not going to. I just want to let my skin breathe. I think I have a facial on Monday. Some things I do for my skin is I get a facial once a month, whether it's a HydraFacial Express, because that's what's included, and Mama has bills to pay, or I'll upgrade sometimes to the HydraFacial regular, which is a couple dollars more. I also got that radio frequency, but I got that as a package right before the winter started, if this is what a winter is. So much fun. All right. What's next? Getting dressed. Be back. So I lied a little bit. I didn't go get dressed immediately. I got my water, my fiber supplement, because having kidney stones recently made everything in my stomach really upset. That is pain. That was some pain. That was a new level of pain. That yeah. That's all I can say. I will talk more about. I can just look at kidney stones, what happened, kind of thing. I'll do that tomorrow. That's what I'll talk about. But that was some pain. So now I'm just trying to make sure that everything in my abdominal area is happy. And I've been compressing, which I know sounds counterintuitive, but I've got some concerns with my blood flow going back up because of POTS or dysautonomia, which we can talk about at another time, but it helps just overall with blood flow and it not pooling and sitting in one spot, and then me getting all like, nah, I'm tired all day. And that is very specific to me and all the testing that I've had and the doctors that I've seen, so in no way am I suggesting this, and this will not be for all day. This will probably be for another hour or two, and then I'll take it off and I'll put it on later again. It's kind of building up to like intermittent compressing, I guess, I don't know. But when I wear the socks, I don't feel great. So I found that the abdominal compression helps a lot more with my symptoms. So I'm gonna drink this fiber drink just to make sure we get a nice cup of water in the body, and also make sure I'm having some fiber in my diet, additional fiber. I also got myself a new cup so that I could drink even more water, having kidney stones. So try to get that done. All right, sounds like it's gonna be a wonderful day. I've already fed the dogs. My hair is so stick straight. It's getting long. I'm trying to decide if I'm gonna do my annual chop, but last year that was kind of traumatic. It was really cute. I really like that length of hair on me, but I was a little bit traumatized. But here I am, ready for work, ready to seize the day. So really, when you drink a lot of water, all you do is pee all day. It's very it's annoying. That I was gonna say it's like a degree away from annoying, but it is annoying because I'm like, I have stuff to do. I can't pee right now, and that's probably why I got so dehydrated and all these things started occurring. So, cheers to water.